Hello everyone, I'm Dr. Aditya. I'm a consultant in arthroscopy, sports injuries and shoulder surgery at Dr. L.H. Hiranandani Hospital. We do a lot of ACL surgeries here, and you will find a lot of resources online describing what are the various techniques, what do you expect before the surgery. But not a lot of resources will be there what to expect after the surgery. And this is quite a good question. In fact, one of my patients specifically asked, how will it be post surgery? And I want something informative with regards to that. So, few things which you are going to expect after surgery. First thing is pain. Is it a painful surgery? Generally no. A lot of things depend on your pain tolerance also, but as such I would say that ACL surgery is not a very painful surgery. We give you spinal anesthesia with epidural anesthesia or in some individuals an adductor canal block, which will help you in decreasing the pain post surgery. The first session of physiotherapy after the surgery is the most painful one. After that the pain starts coming down and you are quite comfortable by the time you go back home. So by the time you are going back home, your pain should be quite comfortable, you should be able to manage yourself, and generally by 2 weeks you should not have a lot of pain. Swelling, that's the second point. So you will experience swelling in your knee after the surgery. You pump inside fluid to do the procedure, and as a result of that the knee may swell up. Generally by 2 weeks the swelling is quite less, and generally by 3-4 weeks you should not have any swelling in the knee. Yes, your knee is going to look slightly different from the other knee after the surgery. That's because the muscles become weak as a result of your injury as well as the surgery, and it takes a few months for them to recover. So if you do physiotherapy well, generally at the end of few months your knee will start looking normal. The other aspect is, when do I put weight on the knee? So post ACL reconstruction, now that's something which varies from surgeon to surgeon. L.H. Hiranandani Hospital, at the surgeries I do, immediate weight bearing, full weight bearing is tolerated after the surgery. You can put your full weight. Initially you will be using crutches and a brace to walk, and once you are comfortable, first the crutches are discontinued, then the brace is discontinued. So the next question that comes to mind is, when will I recover? So that's a tricky question. It means different things to different people. So let's say if you are asking for recovery for you to walk, you can walk immediately after the surgery. When you are talking about walking normally, anywhere between 2 to 3 weeks after the surgery. Now when it comes to going to the gym, generally after 6 weeks of the surgery you can go to the gym. When you talk about jogging on a treadmill, generally by 4 months you can start. When you talk about getting back to sports, playing football or kabaddi or sports like that, generally it's advised to do after 6 months. There are a lot of techniques available, but regardless of the technique, typically it takes around 6 months for the newly reconstructed ACL to heal to the bone. That's the graft bone healing time. So regardless of the technique which we use, it's going to take that much amount of time. So for that period of time, we avoid putting any stress on the graft by avoiding pivoting sports. Yes, you can start jogging and running by around 4 to 5 months, but playing pivoting sports or competitive sports is generally avoided for the first 6 months after the surgery. Then the question is, how do I take care of the knee at home? What position do I keep the knee in? So generally we provide a waterproof dressing. You can take a bath over it. There is nothing to worry, it won't get wet. You can probably cover it with something and take a bath. So taking a bath is not an issue. You can go to the washroom before you are discharged from the hospital. So typically we encourage you to use the Western style commode for using the washroom, and you can use a commode extension. It will make life easier for you at home. And what if I get pain? So with regards to pain, yes, some people may get more pain compared to the others, but that will happen once in a while. On a weekly basis you will find an improvement on your knee. Yes, on a daily basis sometimes your pain can increase, sometimes it can decrease. So it's a variable thing, but on a week basis you will find an improvement in your pain levels. Other question which you need to answer is physical therapy and rehabilitation. That is a very important thing after the surgery as well as before the surgery. Now, physical rehabilitation typically continues depending on your recovery. So typically it takes around 4 months of physiotherapy to get you to full fitness. Now the thing is, if you don't complete the entire course of the rehab, you will never feel confident with your knee. Recovery from the surgery is 70% surgery and 30% physiotherapy. So it's very important to keep that in mind when you are undergoing an ACL reconstruction, that you need to do physiotherapy after the surgery to recover completely. Another question which is frequently asked is, how do I keep my knee? So you can keep as such your knee while lying down in any position, but generally the best position for your recovery is when the knee is straight. So you can keep something like a pillow under the ankle to keep your knee straight. Yes, that's going to be a bit painful, but it will help in a faster recovery post surgery. Intermittently you can lie on your side, you can bend the knee, that's not at all an issue, but try to keep the knee as straight as possible after the surgery. Turning around is never an issue post surgery. Do I need to put the belt after the surgery? That's another question. So you don't need to wear the belt all the time. Only when you're walking, that's important. When you're lying down, when you're sitting, there's no need to use the brace. The brace is very important when you're putting weight on the leg. Another question that comes to mind is, what are the warning signs? When should I contact my daughter? So generally, as I tell my patients, if there is any change in the color of the dressing, if it's just spotting 1 or 2 drops of blood here and there, that's fine. That can happen and don't get worried with that. But if there is any gross change in the color of the dressing, then you come and meet us. Second thing is, if you get fever. So if you get fever which is persistent, take temperature. If it's more than 100, then you come and meet us. If it's less than 100, it's fine, you're not having fever, your body is feeling warm, which is natural. You can feel warm in the evening or after a session of physiotherapy, so don't get worried with that. If you're getting severe pain which is not getting managed with medicines, your knee is getting locked in some positions and you're not able to move it, then you have to come and meet. So I hope this video was useful. This was just an attempt to tell you what can happen after the surgery, how it goes, and what are the warning signs.